Welcome to Rocky Times, Why Agile Leadership is Crucial for Impact. My name is Casey Deems, and I'll be running this Dialogue for Health web forum with my colleague, Jeff Bornstein. Now it's time to meet the moderator of today's event, Karya Lustig. Karya is the director of the Program Office CDC Cooperative Agreement and the Deputy Director of the PHI Center for Health Leadership and Impact, which runs the Leadership Academy for the Public's Health. Welcome, Karya.
Thank you, Casey, and welcome everybody. Thank you for being here today. If we can go to the next slide. So our agenda today is to learn from all the wonderful leaders that we have on the call today. We're going to do a panel discussion talking again about the importance and sort of the why of agile leadership during times like today. And why that's crucial for the impact that people seek in their communities. So we'll be having a panel discussion. We'll run through some questions, kind of introduce ourselves to the topic and get familiar with each of our leaders in their communities, and then have time for questions at the end. So please, again, feel free to type in your questions as they're talking, and we'll get to those towards the end of the time we have together. So next slide. So the PHI Center for Health Leadership and Impact builds healthy communities that create sustainable impact at scale. We're a public health do tank that helps individuals and teams transform their vision into data-driven strategies. We're a trusted partner to governments, nonprofits, and social change organizations that are committed to health equity and multi-sector partnerships. We improve health outcomes at scale with dynamic tools, deep expertise, and cross-sector collaboration. By leveraging local resources and getting regular feedback, our approach ensures that communities have an authentic voice. We address the root causes of health inequities, plan for sustainable impact, and support the development of policy and systems change for lasting impact. Today's webinar is going to delve specifically into the concept of agile leadership. This is a concept that's really based in a leader not being the one that knows everything, but instead can vision, partner, and leverage resources in their local community. It's someone that can adapt to their surroundings and the changing times, which is ever present and super important in today's world. So we're featuring 3 leaders that are from really different communities here in the country. Each of them has some really different examples and ways that they've exhibited and seen the importance of agile leadership in their own work. And they're all alum of our Leadership Academy for the Public's Health program. So next slide. So we're going to move into our panel discussion. First, I want to introduce each of our panelists here, and then we'll go off slides so that we can see everybody's faces as we talk today. So first up, next slide. We have Chris Kirk. He is the Chief Program Officer at Norwestcap. He is from our 2014 cohort. We're on cohort 11 now, so this goes back to cohort 3. He leads a team to develop, implement, and evaluate a broad portfolio of social impact strategies, and he's based in New Jersey. And he has previously been a minister, counselor, and school-based nonprofit leader. So welcome, Chris. Next up, we have Harrison Nadetan. He's a professor of epidemiology and biostatistics at the University of Texas at Tyler. He's from our cohort 8, which is our 2019 cohort, and he's based in East Texas. He's previously served as professor and director of research at Parker University, which is in Dallas, Texas. He's developed 2 large community-based participatory research projects based in East Texas, focused on ACEs and collective impact-oriented work and overdose and substance use disorder in the East Texas region. So welcome, Harrison. And last but not least, we have Lauren Weatherford, who's from cohort 7. So she's 2018 cohort. She's based in West Virginia and is the Family and Community Development Agent for Fayette, I think it is, and Nicholas counties. And she's the Associate Professor at West Virginia University Extension Services. She delivers evidence and research-based information to both professional and community level audiences and has specialized in health and wellness, life management skills, and relationship education. She's served at Extension Services, family nutrition programs, and she's co-authored curriculum as well as other educational pieces. So welcome to Lauren. So we're going to go off slide so that we can see everybody and start working through kind of the questions we have. And to begin with, I think it's important to spend a little time thinking about how you would each define agile leadership and how you've seen it being important for the impact that you seek in your communities. So we're going to start with you, Chris.
All right. Hello, everyone. I love this topic. So I think agile leadership is really about being able to navigate terrain that is changing all the time. I think a lot of times when you read about leadership or you think about leadership or hear leadership success stories, it gets described in a really static way. You have this leader who has a vision and they, cast that vision and bring in people and they lay out a strategy and they execute that and everything is great. In reality, that's never how it works, right? The people change, processes emerge, there's unexpected challenges that come into being. And so agile leadership, I think, is being able to navigate those things and keep moving forward toward that vision despite those. If you'll pardon my analogy, I don't know if I have any other runners on the webinar today, but I'm a runner and I think about this as really the difference between road running versus trail running. When you run a road race, right, you're on the pavement and you can really see a long ways ahead and pretty much you can kind of zone out, right? You just kind of get going and stay in that same momentum. But when you run a trail race, you have to be paying attention because every root or rock or puddle could really trip you up and you could take a spill, right? It's a totally different way of approaching it. You have to be agile. You have to be able to be aware of what's going on in the environment and be able to respond to it in real time as, again, you keep moving forward. So I really think of agile leadership as that kind of trail running approach. It's also kind of the contrast between management and leadership. In situations where we know exactly, what this situation is like, and we've done it a million times, management works, right? We can just keep executing the same processes over and over. But when we're in uncertain times, when we're tackling wicked problems, when we're working in new ways with new people, we have to be agile. We have to be able to respond to those things. So I think that's really crucial for all the work that we do because that is the world that we live in. I think it's really crucial also for diversity and thinking about, to be agile, we have to be responsive. We have to be listening. We have to adopt this sort of humility that we don't know it all and we don't know what we don't know yet. And so I think it's really important as we think about diversity and equity in our communities as well. I'll stop there and look forward to what the other panelists have to share.
Excellent. Thank you for getting us started. And why don't we go to you, Harrison?
Yeah, hello. Thank you, Chris, for sharing your thoughts about agile leadership. I think you touched on one thing that I will begin with. For me in particular, when I think about agile leadership, it begins with maybe three words come to mind. The first one is the change that you alluded to earlier. And when I talk about change here, why driving and promoting change is very important about agile leadership. To me, is being the change. So an agile leader must think about being the change. You will understand that you want to inspire people to be part of a change. You want to be able to understand that action speaks louder than words. You engage in your own development. Actively engage in your own development sometimes is a serious inspiration for others. So I'm thinking about a situation where an agile leader lead change by engaging in a courageous behavior of developing themselves. You want to be able to develop yourself in a way that is visible to others. And then you also think about the fact that, hey, there is no destination here. It's a journey. Okay, you talk about being humble to know that we don't know it all. We have to think about being about the leadership of possibility and purpose. So we want to actively engage in our development. Then the second word that I think about when I think about agile leadership is adaptive. And you also mentioned that when you talk about being responsive to situations. So an agile leader is one that understands, it has a sense of understanding, it has a sense of importance that is in understanding the nature of the underlying issue that they have to address. So you have to try to understand that. You also have to be able to discern the type of problem, whether especially You mentioned management there. I think about it in terms of the technical issues as opposed to adaptive issues, because these issues will require different ways of approaching. So you have to be able to understand that. Also understand the importance of a leadership fit, how you fit in your leadership style or approach to be able to support the different stakeholders that you bring together. And the final word I want to mention with that is talking about stakeholders is a word of collaboration. We want to we don't have all the solutions by ourselves, and so want to be able to bring in, pull in stakeholders to be able to support the work we do. So yeah, we're thinking about, you think about innovation. When we think about changes, the first thing that comes in our mind is innovation, right? We want to bring things different. But you understand that if we collaborate and bring in more diverse voices, then the greater the diversity that we bring in there, the greater the innovation that we expect to get. So those three words are the immediate things I think about when I think about agile leadership. I mean, change, being the change that we want. You want to be adaptive and understand the situations very well. You want to also be collaborative and bring in multi-stakeholders from different sectors to be able to do things better. So then one thing that is a question, I don't know that I have a minute to talk about that, is in your opinion, why is agile leadership crucial? Well, I think immediately about the fact that a lot of times when we try to solve a problem, the leader, I see in my own organization everywhere, they try to bring in situations where those below you be trained and all those things to get to what we have to solve. It's almost like the leader himself is out of the situation. So it doesn't try to have the ownership of the responsibility. So where you start involving yourself in the training and being part of the problem is important for us to be able to implement the change that we need.
Excellent. Thank you so much. Great points. And let's go to you, Lauren.
Well, the good news is I also have 3 words, but I get the benefit of getting to listen to everybody else before they talk. So it's good that my 3 words were not the same as Harrison's, although they're certainly related. I really work in some pretty rural communities with very small groups of people that address these issues. And lots of times it's the same 10 people at the table. And one of the things that I was recently working with some students in terms of community development efforts, which relate to things like health equity and the areas that were, they're interrelated, these problems. So one of the things we were talking about is the textbook was addressing the fact that, get the key players in mind, set your goals, have this long-term strategy in mind. And then we had a long conversation that said, that's great. And what happens when 8 out of the 10 people in the room change jobs, move away, or decide they're not interested in that project anymore? So then you must adapt. Just like Harrison and both Chris were talking about being responsive and adaptive. But the 3 words that I really want to focus on, the first is sustainability. And when we're working with organizations and communities that we're working in, we are trying to accept the fact that these changes are going to take place. One of the things where I live in particular, some of you may have heard, some of you may have no idea what I'm talking about, but I live in a place called Fayetteville, West Virginia. And Fayetteville, West Virginia is home to the New River Gorge National Park, and we just became a national park. So we have some really big issues like loss of population, lots of poverty that still persist in this part of the country. And yet then we have this influx of tourism that's happening all over our region. And so we are having some really crazy challenges that are happening. How do we deal with these things that are coming into our community, as well as these problems that have not gone away, and in some cases are being exacerbated? And so understanding that as all these changes are taking place, that you really have to have that patience. So both Chris and Harrison referred to long-term kind of vision and strategy and keeping that goal in mind. And one of the things, when my cohort did our presentation, one of the things we put up a picture of a turtle crossing the road, because sometimes that is the image that I have in my head. As long as we're still moving forward, it doesn't really matter what has happened in the environment that we have. So sustainability is the goal. patience in order to get there and whatever changes may occur. And then lastly, in terms of leadership, I really think that education is such a key element of that, because so many times we are working with groups of people who come from a particular point of reference, a particular skill set, but they don't really understand a lot of what's happening with the other people, or maybe some of the elements of the problem that you're facing. And one of the roles of leadership then is to be able to help people not only communicate, but also educate and start to understand each other and different elements of the project at hand.
Excellent. And I love the little 3-word theme thing we have going on here. So let's move into some kind of stories or kind of lessons learned as an agile leader. So kind of what are the most important lessons you've learned? And if you have any specific examples of, projects or things you've led where you can exemplify some of those lessons, that's great too. So let's go start again with Chris.
All right, lots of lessons learned and learning. A couple of things I'd mention. So one of the things I remember early in my career, I love creating plans. I love, coming up with ideas. And early in my career, I would find myself, when inevitably those ideas didn't go to plan, I would find myself in 2 places. I would either sort of want to stubbornly push ahead, right, with my great idea and, keep beating it to death. Or I would like to say, oh, we had an idea, it didn't work, so let's just scrap that and try and start something brand new, right? And so in both of those scenarios, there's sometimes I persisted too long in a strategy, and there's sometimes where I didn't persist long enough. And so I think agile leadership is kind of being able to understand when you can do that, and when you can sort of make a small change instead of abandoning the plan wholesale, when you need different perspectives to come and help solve that issue. I think that's one of the most critical pieces there. One of the things that's really helped that is adopting with myself and with my teams really an experiment-based mindset. That whenever we're thinking of changes, it's really daunting when we come up with a big vision, big platform, we sell it, here's the grand plan, and it's hard to get your head around. It takes time to get buy-in. Sometimes it's appropriate, but sometimes what we're trying to do is make those small changes, have that patience that Lauren was talking about. And not every change has to be permanent, and not every change has to be like our best guess, right? So we've, in my team today, we've adopted a lot of practices around like agile project management, rapid cycle learning, to be able to come up with ideas, generate more ideas, to be able to take those ideas and test them out for a period of time to see whether they worked or not, to decide whether we want to tweak them or just never do that again. And that has really changed the landscape of being able to lead in this environment, because we're like, hey, why not try it, as opposed to here's an idea that we're going to live with forever and then we can love it or hate it. So I really recommend sort of adopting some of those practices. I've been learning how to use those more and more. And then finally, I would just, again, reemphasize the importance of humility in all these things, that my idea is not the only idea or the best idea. And as we navigate these landscapes, that we're open, that we're listening, that we're taking in the new information, not as something that is an affront to your idea and your concept as a leader, but as something that is a step on the journey that you can learn from, and having that humility to accept that, I think, is vital.
Thank you. And to Harrison.
Chris, it's hard to be coming after you. I wish they can randomize this thing again. But yeah, talking about some examples or the importance of some lessons important lessons that I've learned about agile leadership and how to apply in a situation. There are 3 things that I want to share again. I like the number 3 today, but the first one is about constructive uncertainty. This is something I learned from NLAF. And because of the difficulty of the situation that I have in my 2 projects, I had to have the opportunity to practice that. So during one of our catalyst presentation during NLAF was for us to practice how something called the balcony and the dance floor. You know, at the dance floor, we are there with actions, and then we have to stop and pause and go up to the balcony to reflect. So that reflective practice has been very important or needed highly for what is going on with our opioid project. See, when we applied and we got the funding for this project, I thought it's something that would just get in there and run in the community. Okay, one, there is stigma that's associated with the situation we want to address. It's not one of those situations that you claim that the solutions are all well there. So we have suggestions everywhere, but it doesn't apply in every community similarly. Rural community, there's complexity of being able to create connections, and then also have people to come and talk about somebody who doesn't even understand the situation in the community, or is not looked at a typical community member to keep talking about the situation. So that complexity was there, and then COVID comes in and disrupt even the initial connections, the relationship we try to build. So there, I had to think a lot about the difficulty we're spending. So I had to go on the balcony to stop and then to pause and think. And through thinking that, there are two approaches I've used for my pause. The first one is the pause itself is acronym for specific things. So the first approach is for me to just focus and think about, pay attention about me. So it's focusing on me. I think about, well, what is it that I'm doing that doesn't work? So I pay attention to the situation in particular, what is going on here. And that's the P. Then the A is for me to acknowledge that I come in with my own interpretation, with my own perceptions, and my own reaction to things, and my own judgment. And then the U is to understand that, well, even though I bring this judgment as a leader here, leading this project, I understand that there are other judgments and other perceptions that can be very, very important for us to think about and apply. And then I have to do some searching and read and find out, okay, which what models will work well. And if I finally get an approach, I want to try to act upon it fast. That's the E, which means execute. That's one way of looking at that. But another way that we look at is in the whole project itself. One is to allow patients, the P there is for patients, allow patients to inform the way we are dealing with the situation. So we have to be patient. This rural community and opioid project is not one that I was going to get the type of results I put on my work plan. And the goal that I said, I have learned to be patient. COVID keeps coming up, the community opens up and they close back. We go to the jail, they allow us to come before the date that we're supposed to is closed again. So I have to allow patients to inform that. Then the other thing is the A is to take action. Action is very important. So you have to take action in collaborative. I have to engage members of that community in different ways to be able to collaborate to get the results. And there, with the wisdom of the fact that we need diverse voices, the wisdom that comes from diverse voices. And then the U there is for us to be able to understand the role of individual and collective actions, because the different times I want to do things one way, but I have to understand that, well, the other stakeholders have never experienced what they do, that I needed them to be able to come in and collaborate to get the results. Of course, as well, I have to keep talking to myself and to the rest of the members that we need to sustain our commitment to leadership development. That's why we participate in the community of practice activities. That's why we try to read things and also listen to others and seek coaches and mentors to be able to help us. And then the last one there, the E, is to engage with kindness, with regards and with respect. That is very important for the community. This community, again, they don't know us very well. They look at us as if we're coming from outside to try to solve a problem. And so I rushed through the remaining two things. So that one was the constructive uncertainty, where we have to pause and we reflect. But then there are other two things that I've also learned and that is helpful. One is to be able to, we have to constantly enhance those qualities of agile leadership that we've all shared here. We have to constantly enhance that. So be comfortable to work in complex situations. That's one very important quality there that we have to keep working. Of course, I talk about using both your head and your heart, and then also always constantly scanning the situation and be adaptive and reflective. Then the last one of the three, so the first one is constructive uncertainty, reflective practice. The second one is keep developing and enhancing your leadership quality, your agile leadership qualities or adaptive practices. And then the last one I want to talk about is the role of persuasion. Because I need the community members to act as liaison and get this information out there, and I'm completely new to the community, I have to really see the role of persuasion. So persuasion plays a big role, and I've been practicing some 5 steps to be able to come across as being persuasive. One is to try to articulate well the problem we have, where that we need change. Right now, I have to bring in some changes right now. Before this talk, that's what I just got back from Cameroon, and I'm thinking hard about how we're going to be canceling a conference that we designed for Saturday, and because of clashes and things. So one, you have to learn how to associate the situation, associate pain to your situation, what you're doing right now. If you can associate pain to that, sometimes people see it better as one step of the steps to persuade others. Another step is for us to think preemptively, try to deal with the potential objections, because people always want to object to things that you propose, especially when you're looking at change. Then you want to demonstrate that the change that you desire is actually consistent with current values. It's not a radical change. People have figured out that people don't like a lot of changes. And then also carefully paint where all the results will look like, the destination, finally ask for help, engage the stakeholders to be able to design the action. So that is the I try to apply, or I'm thinking about to bring my agile leadership in trying to address some of the changes that we have right now. So thank you.
Hey, thank you. And Lauren.
Sure. I'm going to start with something that is very practical, but for me, it is something that is really essential to these other things that then come into play. And that is having a philosophy of effective meetings. Because one of the very first things that we talk about when I'm working with a new group is that idea that the meetings are for the discussion of the work that has been done and the work that needs to be done. The work does not get done in the meetings. The work gets done between the meetings. And I will say that NLAPH did a very good job of that throughout the year, even sometimes when it was very difficult to try to get the work done between the meeting times. But when we talk about that, because I find that if people will value the time that they contribute, if they feel like they're being utilized, if they feel like they're moving forward with the projects, even when situations become hard and you need to change things. But really, when you focus on that, we're always working towards something in each meeting. We're always using that time wisely. And when you give us an hour or 2 or even more, it's going to be worth your while to give it to us because we're going to have outcomes. So that's where then when we start with that philosophy of effective meetings, then we start to work on those other things like the planning and the outcomes and having the data and understanding of your environment. Because then it's easier to start to talk about those things if we say, listen, this is for some very specific tasks that we're going to do. And then we talk about, okay, so we need to talk about what our outcomes and why are we doing this program? Why are we, what are we hoping to achieve by it? And a lot of times, I don't know how it is for everybody, but I work with a lot of folks who really their mindset is, let's get in and get going. I don't want to talk about how to do it or these other things. I just want to get moving on the project. So if we talk about, we will do that, but we have to do these other steps first. Talk about those outcomes that are going to stay and say, this is going to be the thing that we're going to come back to time and time again. Then we're going to say, do you understand the environment you're looking at? That's where some of those educational pieces and the data collection come into play. And then the next step of that, beyond the planning, is celebrating the smallest of successes. Because in terms of not only having effective meetings, but also it goes along with the reflection, it goes along with the constant program assessment, and it taking that moment to say, hey, we really did something here. It was small, but it was a critical piece to get us to the end result. Because I find that it's so easy to just keep looking forward, and you do have to look back and document the change as you go. Because not only do you need to note it, but you need to track it so that then you can start to see that progressive picture. I've even gone so far in certain meetings as to have graphs that we shared with people and say, look where we were, look where we're getting. And just understanding that the journey is progressing, even though sometimes things get in the way of that. And then the other thing that I just want to mention is really, because you are working with diverse audiences, you're working with changing audiences so often, is really practicing your listening skills. And if that means you need to stop what you're doing to do some listening activities and professional development along those lines, so that people are hearing each other and that people are starting to understand that people come from these different perspectives and there's motivations for those perspectives. And this is how we're all going to contribute to this bigger end. I think that those are some of the lessons that I have learned over time that I just repeat and repeat and repeat with different groups that I work with.
Great examples from all of you. Thank you. So now we're going to jump to, so everyone, all of you are alum of our Leadership Academy for the Public's Health, which is kind of a guided process that teams participate in Casey just dropped a link there for people that aren't familiar with it. So it's a program that's focused on teamwork. Each of you came into the program with multi-sector teams, focused on your leadership skills and the projects you were engaged in. So can you talk some about parts to the guided sort of process? Was there certain curriculum that helped you think about adaptive leadership? Were there certain tools? So you've mentioned like reflective practice, like certain practices that you've then carried forward with your work that you found particularly valuable in thinking about what people need to do this work well. And we'll start again with you, Chris.
Great. So our team, just for context, was a multi-sector collaborative focused on developing a coalition around community health improvement and community assessment. And when we participated in LAP, we were really a young group. We did not. We were younger then too, but we were young in terms of our relationship. We had formed this organization just I think a few months prior, and we had some good players around the table, but it was really formative for us to be part of this experience. I remember some of that began with the whole big picture exercise and coming out of the sort of opening gathering, just taking a moment to sort of redefine what it was that we were thinking about and what we wanted to create and how that might have evolved from maybe the original vision or the things that were there. And that was, I would say, was a theme throughout our entire experience and even the years that followed, where we kind of thought we had an idea of what we were going to accomplish. And then often we would invite someone new to the table because that was the idea, to build it. And then we had to kind of redefine what the scope was. So, that was just persistent part of that process. I do recall our mentor annoyed us to no end because she was always asking us questions about bringing other people to the table and incorporating those new voices. And we were, at times kind of like, hey, we got this figured out already. And then we would kind of go back to that. So I thought that was really key. And then the framing, the message part of that was really a key sort of activity at the end, near the end, where we were able to then kind of refine and say, how do we talk about who we are and what we do, and bring that forward. And so it was a great experience for us. The group went from sort of a fledgling group. I think we had about 9 organizations when we went through this or started this, and grew to about 150 organizations in a couple of years. Now it's actually a 501c3 with an executive director doing great work across the region. And so the experience really helped us kind of get on those right steps and toward consistently learning and evaluating the natural.
Excellent, thank you. I didn't realize it was so big. That's amazing. And Harrison.
Yeah, it's again similar experience, and I'm excited to know that we're not alone in the experience we had. So this is what happened with us. So NLAP, I would gladly say again, that is one of the best things that happened to me in East Texas. So I've been in East Texas, this is my 4th year, and NLAP set the ball rolling for me. So when I just moved to East Texas at the end of 2017, I was still struggling to understand the nature of our mission as a university to our community. And there was a health status report that I read, and it's showing how poor the health status of our region was. And as a school of medical program with a public health program, we have to look for solutions. So I was there reflecting on what I can do. And it's a rural community. Rural communities are tight. It's not easy to penetrate. So the very first thing I thought about when I saw this program was to pull in some influential leaders. So the executive director of the health district, I just barely saw him because he was serving as a mentor to our MPH students. And then I also met another person who was running an 501c organization, a non-for-profit on HIV. So these two persons, they had links to the university. I talked to them, or they have me pull out another person who is acting on a chair. It's a chair of the board for the local churches around. So these are people we met. I've never known them, no prior relationship, but now we have to try to come together to be able to bring change to impact the health status of our region. So NLAB, the very first thing that NLAB provided for us was to help us develop as a team. So that team development. So we came in a situation where we're just at the form of just forming, trying to figure out how to establish expectations and the like, and develop trust, because we did not really know each other very well. Of course, they had worked before me, but I didn't have that. And I needed them as leaders to be able to penetrate the community that I want, to be able to sell whatever we'll be proposing as a solution to some of the problems. So that's one thing. So walk through the various stages of development, and love help us with the model and with the support of a coach. That was so inspiring, and I can't even thank Dr. Mark Morton enough. He was a great coach for us. And so that's one thing. Then the other thing that NLAB provided us that was great to help us. So apart from building and bonding, it gave us the opportunity to enhance our leadership skills, all those individual leadership development things that it offered us, and the ability to work effectively with across sectors, because we all came from different sectors, and the people we tried to bring together to build our project were all from different sectors. And by the way, one thing that I did not mention that Chris also alluded to is the fact that we started with one thing as an idea. The very first thing was to look at something that somebody was working at, HIV, as it's one of the problems we have. But immediately we went in for our retreat, which NLAB provided us in Atlanta. We discovered that not everybody was interested in the same thing. And that was the first time we really actually actively talking about the topic. And we're a little bit ashamed to mention it, because we thought that we had to be a well-established group. But through learning about network mapping, learning about how the stages and different things that we have to think about to be able to effectively build our project completely evolved. In fact, the most important thing that they offered us in that was this the action learning model, where we have to cyclically think about our problem. We plan, we do, we check, and then we act constantly. And we evolve that into a collective impact initiative. And then we started engaging members of our community to think carefully about the problem. And we finally narrow it down to these two things I'm working on now. One is the opioid problem, and the second is adverse childhood experience. So it's a tool that they provided us that helped us a lot. The entire curriculum or the methodology was very important. I talked about the individual coach that worked with us a lot and helped us shape our ideas by asking us deep questions, so we had to think a lot. But there's also this network mapping that was very important, because they were able to pull the right people to the table by constantly think through the different things that we were missing. Thinking about the strong leaders in our community, think about those who are philanthropy, those who are policy advocates, those who could fund different things. And that's why we kept bringing the leaders. And again, because of those other members of the team, were able to invite these leaders participate, and we still hold tight even with COVID. But then our big picture diagram is what actually helped us to shape that idea to what we currently have. And then there's another, to be able to bring people to contribute and stay in our task forces, we had to use data a lot. So, and we learned about got data during the program. That's when we started using the data we have, do maps like Lauren, to show people what the current situation and what we think we can achieve. And right now we have each of the projects, we have different task forces. In our ICE project, we have an awareness task force, we have a prevention task force, we have a treatment task force, we have a recovery task force, and we have a support service task force. So we have different task forces. And then for our opioid project, we have 3 main task forces. But first of all, we have a consortium, the key organization that have come together. Then we have task force for prevention, treatment, and recovery. And of course, we have a data monitoring and evaluation team. So those are important things. But again, for me personally, there are 2 other important things that I use a lot. One of them is framing the message. When we had to bring people together and talk about that tool was the most effective thing, how you frame a message. And that's one thing that NLAB gave us that was wonderful. And then I was always thinking about this Peter Block's 6 conversation that matters. How to think about inviting the invitation, how you bring people together and tell them to collaborate, how to think about the possibility, how the future needs to look like. Of course, we're clear that it's not fixed. Have to think about, well, who owns this? You know, in a collective impact initiative, that's one of the challenge when you try to align different efforts. People start asking who is going to own what. And so I had to think about that. Then also think about people's commitments, and of course, acknowledge and capitalize on what each person will offer. So those are important things that we're able to use from NLAB. And that's not all, there's just many. We don't have enough time to share all, but NLAB was a wonderful program. Again, I can never emphasize enough that it's the best thing. It helped me. I came here, I was associate professor. Through building this impact on the community, I was able to get my tenure. That's one thing that gave for me as a benefit. I didn't know that I can engage the community, but I learned all those skills from NLAB. I'm originally from West Africa. I didn't know how to penetrate the rural community and get that. So I learned a lot within that 1 year, and continue. Our coach has remained our friend, and so I can call him. I was applying for my first rural implementation project where I got the first $1 million funding. I had to talk to him and a lot. And so that's a relationship I built through NLAB. And it's just been an amazing thing. So I can't thank NLAB enough for all the opportunities they offered us.
Great, thank you so much. And Lauren.
Sure. For us, it was very interesting. One of the primary goals that we had as a group, we chose our group. I talked to some people. We had a health prevention organization in the county called the Living Well Work Group. And one of our very first goals at working with NLAPH was to help that initiative to become more sustainable, because we knew we were struggling. It was very much susceptible to the one leader steps down, and which in that case was me. And so we were trying to build sustainability. And so we took several members who had participated in that group, but also who were working in a particular community, who came from very different points of view. And for me in particular, because I work with the university, I had not, while I work in public health related issues, I do not work directly in public health. So it was a neat professional development opportunity for me to step outside of that comfort zone in terms of the areas that I usually work, the kinds of professional development, the point of view that I usually get. And I was very excited going into it about that. Well, I will be perfectly honest, the Living Well Work Group folded about 18 months after the end of the NLAPH. But honestly, that had nothing to do with it. It was just one of those things we were trying to address, but it didn't work. However, so many of the various skills that we did look at, some of which I was familiar with, maybe from a different perspective. So things like the big picture and the got data section, community assessment, asset analysis, things like that we work with. But it was very fascinating and educational for me to get it from a different point of view. So for those of you who are not directly in the public health sector, even though there is this focus on public health, I think the multidisciplinary team really enhances that, because you're able to get these different points of view, which I think contribute throughout the entire process. And just getting those different tools, I think you're going to see some repetition in our messages, because I also found the reflection to be, and our team overwhelmingly said that was one of the most impactful elements for them, was learning to reflect as you go. And you can see from my answer in the last question, where I talked about celebrating those successes and tracking those data, that the reflection pieces were really critical. And then also that framing the message. In fact, I'm working with a group doing prevention activities, and we did a community survey. And in the community survey, they were talking about, okay, well, now we have the survey results, we need to get that out to the community. And one of the first things I pulled out of my bag of tricks was some of the framing the message documents, because they're one of the things that's really good about the materials that you're given to work with is they appear to be very simple. So you can read through them and get the concepts very quickly, But then when you start to fill them out, they become incredibly complex very quickly. So it's that kind of that little bit of an illusion that, oh, this will only take me 10 minutes to do. And then you start working on it and you find that there's some pretty in-depth and complex activities and thought processes that go with it. But that framing the message for us. So, and just with this prevention survey, so we did a survey in middle school and high school of self-reported views on prevention issues. And, you know, if you just think about when you're talking about substance abuse and prevention, who are the people you need to talk to? Well, there's a variety of different people you need to talk to. You need to talk to the parents, you need to talk to the students, you need to talk to the administrators, you need to talk to the community members and the business leadership, all these people to which it affects. And they all need to be spoken to differently. And some of those worksheets that we went through here were really, really important. So and just the culminating report is always good, because for us, the nice thing about the culminating report, it's something that we would not have done. We all continue to work on this project with, there are 2 small communities that bridge a river. The only grocery store in the area had shut down. And so food insecurity was a focus of part of our programming. And they wanted to develop a trail area that connected these 2 communities for tourism and economic development, community development, that kind of thing. But then it also became a health, food insecurity issue. It connected the senior citizens home to the only food access, no longer a grocery store, now there is one. But you were able to cross that bridge, literally cross that bridge, and join these 2 communities together to receive access and services. And so it did become a big public health issue. And one of the things, not having done that culminating report for us and these 4 people who worked in these very different disciplines and kind of somewhat worked in this area together, we have more than once pulled that culminating report out and said, as of 2018, 2019, this is where we were, and this is what we're continuing to do. So it really gave us a nice milestone in which we were able to kind of continue to work. And then we have actually talked recently in a meeting about, why don't we do another report and kind of look at where we are now that it's been several years later, because with the pandemic and all those changes that have taken place, it might be a good time to kind of stop and look at those outcomes that we are trying to reach and where we are in the process.
Excellent examples. Thank you all. So when we think about health equity in particular, and ways that adaptive leadership might be useful, and this could be, any of you can jump in on this, but just kind of thinking about how you address health equity. I think each of you kind of mentioned it at different points. In what ways does adaptive leadership, or kind of thinking and that kind of mindset, help you think about how you address health equity in ways that might be more impactful than other ways of leading? Any thoughts from any of you?
I'll go ahead and jump in. So for me, again, the type of work that I do, we tend to be grant funded on certain projects, which give us very targeted audiences to work with, very targeted populations. And so some of the educational pieces that we got with health equity, and again, not being from the public health sector specifically, there was a lot that I learned about health equity, about the impacts of health equity, about the issues involved in health equity, understanding, I had not worked with housing previously, and understanding how housing was really such a critical piece that fed into, where you live, what kind of environment you live in. And it's logical, but it's also something I wasn't aware of. So being able to kind of step outside of those specific projects that I generally work with and look at that health equity gave me new perspective that I know I now bring into other projects. So understanding that if we're doing trail development and that there is a community health development piece of that, how are we making sure that it is not only available to everybody? Are the access points where everybody in the community can get to them? Are we making sure that it's safe for everybody? Is it accessible? If you build a gravel-based trail, that eliminates a lot of people from being able to use it. Are there paved sections? And are there ramps to get to and from the trail, those access points? Those are things that I now think about that I never thought about before.
Anyone else want to jump in on that question?
Sure, I would just add, I think health equity in this whole approach is leads you to thinking and hearing from other people. One example from our project, we had conducted a community assessment. We did all the right things. We brought all the stakeholders to the table. A lot of participation, and we'd identified some issues. One of which was emergency room utilization, and another was obesity. And then we took that information because there was a particular community comprised predominantly of Central South American immigrants that we went to them and we said, hey, all the experts in the county got together and we identified these like 6 things as the issues. What's the biggest issue for you? We wanted to hear from them, and they almost overwhelmingly they marked other and they put housing. So it wasn't on our radar, but it presented an opportunity for us to say, well, how do we then respond to that, right? Because we have healthcare institutions and public health entities and folks that don't involve the housing space. And at the end of the day, it required us to shift some strategies, to bring some new players to the table, to be able to be responsive to what they were seeing as the equity issue at the moment.
Great example. Thank you.
And yeah, so just to add to that, so in our own situation, is this whole adaptive reflective practice. We try to build a cascade of care for opioid use disorder, and using the data, we're able to paint clearly and be able to identify that, well, the solutions we are proposing, typically some of them or some of the steps do not work well in our community, even though we discuss it in our other webinars and collaboration that is important, but some don't work in every community in the same way. So we will try to analyze data for the various communities, so the entire county that we have, and then we look at the subsection of the county differently. Things don't just work exactly well for every place, for everyone. So there are those that are a little bit in a situation that's like the urban, that our services are very close to them, but there are others who are very far off and they have even transportation issues. So we look at all those. We're trying to figure out how we navigate through that. We try to bring in even the telehealth. It does not work as well, because even with that, there's a problem and the problem of devices. And so constantly to be able to think about different ways of addressing problems for different persons differently, because it's not that before this project, I was thinking about things in terms of this is all, it's almost like equality. This is what will work for everybody, but it's not true. Different segments and different sectors, even different individuals require different things to be able to get to the same or to get to a good level of their health. So it's just giving us an opportunity to think harder about what works for, or what is the demand for different people, and see what we can do to be able to address that.
Excellent, thank you. And I guess the last question I have is, how do you, and we just have like a couple minutes more, I think, here, but just quickly, how do you sustain the leadership journey? We all talked about this as kind of a journey, that this model of leadership doesn't give you the, like, I've achieved success as a leader, or I kind of know all the things about this topic or how to do it. So how do you sustain your work and your kind of vision, and kind of create benchmarks or do whatever you need to do? Kind of what kind of strategies do you use for yourself as a leader in this space?
Okay, so I will start. For me, is first of all understanding this whole role of leadership that emphasizes possibility and purpose. So reflecting in the situation that we have, like right now, we're going through some difficulties in terms of the responses we're getting. That just gives me, even this morning, I was just thinking about this, an opportunity for me to practice some of the things I learned. And then also, so when you see those situations coming, with those complexities coming, you have to think harder. But also it is that of purpose. So you engage into mentorship because you want to address some specific thing. So the continuous thing, you look for mentors, you also be part of a community like this one, community of practice, and then also get some individual mentors so that they can constantly help you address those specific things. So you learn for those specific things, and so you continue to grow in that spectrum. So that is what I see that will help in the sustainability in terms of constantly seeing any opportunity that comes your way, and you look as a possibility for growth, and then also constantly invest in learning things that will help to address the specific things. So it's leadership for purpose or learning for a specific purpose.
Yeah. So one of the things that came out of our cohort that we have stuck with and now has become, particularly with those people, I know when I've worked with them in other capacities, this continues to come up, is that when we think of community engagement, we're not just thinking about kind of the traditional engagement pieces. We always incorporate, we ask the question, where should youth be involved? Not should youth be involved, but where should they be involved? Because we find that also creates mentoring. So the other element that we have with that is that it is really shared leadership. So, when I'm helping an organization to get started or to reorganize or to look at sustainability, I'm more of a facilitator than I am a leader. If you think that leadership means that I'm doing the initial administrative work, then fine, I'm a leader. But when it comes to the real content, we're looking at shared leadership. And so then we talk about, we actually are making some very practical steps in terms of when working with a group, we're asking people, will you give 2 to 3 years to this project? So sometimes they're doing that by, grant needs or something like that. But sometimes we're saying, will you commit to be with part of this project for 3 years? And during those years, will you spend at least 1 year in a leadership position? And so we're starting to really have those places where the leadership rotates and people know it's coming. So they're starting to get ready and do that. And then we have had youth who have been engaged in projects who are now starting to step into those as they become adults. And so those 2 elements of a real commitment for a short period of time or a midterm period of time, as well as engaging youth and different audiences that you're not looking for or you're not expecting. That's really key for us.
Great. Thank you all so much. We're running out of time here. Excellent conversation. Thank you. And if we can jump forward a couple slides. Great. So just wanted to let people know. So again, we are opening the application period in August for the Leadership Academy for the Public's Health. There's 2 information sessions, one in August and one in September that can explain more about the program. And again, it is everyone that's on the call today is an alum of the National Leadership Academy for the Public's Health. We'll be recruiting for our 12th cohort. This is a program funded by the Center for Disease Control and meets with their interest to help expand the leadership skills of public health and its important partners. So please feel free to reach out or attend one of those information sessions if you're interested. And next slide. For any information just about our work in general, feel free to call, email, or just check out our website to learn more about our work and how we might be able to support your communities.